My name is Cheryl Kane, and I'm a nurse with Boston Healthcare for the Homeless program, and I work as a street nurse. And I work as a part of a team with 2 physicians, a physician assistant, a psychiatrist, and a social worker. And basically, we provide primary health care to homeless men and women who live outside on the street. We walk during the day, we walk all over Boston, and during the evening time, a van goes out 2 nights a week. I started working at Boston Healthcare for the Homeless in 1997, and actually I had just graduated from nursing school. I went back to nursing school because I used to watch the doctors and nurses from Boston Healthcare for the Homeless taking care of patients at a shelter clinic, and was so impressed by the respect and the dignity with which they treated each patient that I decided that that's what I wanted to do when I grew up. When I think about the challenges of taking care of our patients, I think one of the biggest challenges that we have to learn how to overcome is developing a relationship of trust with people. Most of our patients have been victims of incredible trauma or violence in their lives and don't come by trust easily. And so for us, it's absolutely critical that we develop a relationship of trust in order to be able to provide the health care that people need. Very often, people are so worried on the street about where they're going to sleep that night or where they're going to get their next meal that their health care needs fall to the bottom of their list. And so for us to be able to uncover what those needs are, it's really important for us to develop that relationship of trust. When someone trusts you enough to tell you their story and to tell you who they really are, that to me is one of the biggest privileges of being able to work with our patients. Working with our homeless patients and being able to focus on them and not my own self was just, I'll always be grateful for that experience. Community is everybody that we interact with every day. Being able to interact with people and to be able to share the experiences with people and to share the things that I've learned that other people have shared with me is just an important part of life, I guess. We're all the same. We all want to be happy. We all want to be cared for. We all want to be loved. And so when our patients tell us that and tell us who they really are and what they desire in their lives and what they long for, then to me, you begin to see people with different eyes, because that's where the real healing begins, when people can feel like they're their best selves.